Dr. Gazsi, how would you treat fibromyalgia?
Treating the cause of fibromyalgia is really important. Fibromyalgia really is a condition where the body is not making enough energy in the muscles. So the muscles go into what's called a lactic acid cycle, meaning that they burn as if you were working out too hard. But for a person with fibromyalgia, walking up the stairs or carrying something normally is actually working out harder than the muscle could handle. And it goes into the lactic acid cycle, and that lactic acid burns the muscle. Just like if you've ever worked out too hard, you feel sore the next day. Well, for them, walking up the stairs is working out too hard. Doing normal chores is working out too hard. So the goal is to increase the energy production in the muscles. And the reason that energy production isn't working varies person to person. For some, it's a lack of oxidation or oxygen in the body, so we use oxygen therapy, which is very, very helpful. For some, it's a lack of nutrients, the nutrients that they need to actually activate the energy process in the body, so we'll test for nutrients, and then we'll give them those nutrients in a therapeutic dose. The real important part is the therapeutic dose. We have to use nutrients that are not only highly absorbed, but that we have to use them in a dose that actually will be effective. And over time, it does take time to get that nutrient level up in the body. And then the third thing that often is a case with fibromyalgia is a toxicity in the body, and that those toxins are actually stopping the energy production in the body. So we actually have to put the person through a sequential detox, and it's very important for that detox to be sequential, meaning that we start with the end point, which is the intestine, and then we move on to the liver, and then we move on to the blood, and then we move on to the muscles. So it's actually a several stage detox to address the toxicity. Of course, testing for that is important. We do a test called a meridian test, where we measure how toxic the body is, and then we know whether that's an issue, or if we, again, test for nutrients to see if they're deficient, and we address those issues. And once we get the issues addressed, the person recovers, they have less symptoms, and they feel better.